friends, pull up a chair. Welcome to another episode of Sharing with Friends on behalf of Sharing Down Syndrome Arizona. October is National Down Syndrome Awareness Month, so we have some very special guests joining us today for this very important conversation. Up first is our friend Katherine Brendish. She's the director of ASU's Genetic Counseling Program and clinical professor. And then joining us for the second half of the conversation is Ellie McGregor. She's a second-year genetic counseling student in ASU. Today we're going to be diving into the conversation, chatting all about the genetic makeup and causes of Down syndrome. Such a great topic and conversation for this month in October. So, Katherine, thank you so much for being with us. We're so excited for this conversation.
Oh, thank you for having me. It's an honor to be here.
So, first off, talk to us about the genetic causes.
Absolutely.
So what genetic causes or genetic change causes Down syndrome?
Absolutely. What a wonderful question.
Mm-hmm.
And often when we see patients and families that have children with Down syndrome, this is one of the first questions they ask us. So I'm happy to address that right off the bat. I want to start the conversation, though, by kind of backing up a step and helping everyone sort of appreciate how we're made up. Okay, So when we're born, we're all born with 46 chromosomes in every cell of our body. And we inherit half of those chromosomes from our mother and half from our father. So essentially we have 23 chromosomes we get from dad and 23 from mom. Now, our chromosomes are important because they're the structures that carry the genes. And the genes basically give all of our cells in our body the instructions to do what they need to do. So our genes help us develop, they determine our personalities, and they traits that we have, as well as potential diseases that we may have in the future. When somebody with Down syndrome is born, they're born with an extra copy of chromosome number 21. So going back to the fact that we're all born with 46 chromosomes, we inherit one copy of each chromosome from mom and one from dad. When someone with Down syndrome is born, they inherit two copies of chromosome 21 from one parent and one from another. And that gives them three total copies of chromosome 21. And so that's why you'll often hear Down syndrome called trisomy 21, because there's three total copies of that chromosome, when essentially most of us will have two copies.
Okay, so let's talk a little bit more about, and you touched on it a little bit, but let's dive into a little bit more on if Down syndrome is inherited. Can you explain that a little bit more to us?
Absolutely. Another really important question that everyone wants to know about. And I really want to start this part, my answer, by saying that when somebody has a child with Down syndrome, it is a random event.
Okay.
There is absolutely nothing that parent did to cause it. They had no control over it. And one of the things that, as a genetic counselor, that I work with families about, it is helping our families and parents understand that they didn't do anything wrong. And oftentimes when they have a child with a condition, any condition, but Down syndrome too, they think that's because something that happened during the pregnancy, or somebody had told them some misinformation perhaps that they learned, that you did something and it related to causing Down syndrome. So first and foremost, when this occurs, it's completely random. In about 95% of the time, it has nothing to do with anything that is inherited, where there would be a risk to have another child. The cause of Down syndrome is just a random event that occurs right before fertilization. So as the cells are becoming a sperm and the cells for mom are becoming an egg, there's a event that just happens sporadically, and that extra 21st chromosome gets passed along. And Ellie's going to talk a little bit more about the cases in which there's something more serious running in a family, and the risk to have a second child would be a little bit higher. I also want to point out, though, the fact that anyone at any age can have a child with Down syndrome. It happens to people in their 20s and on up. I do know that many folks are aware of the fact that as women get older, the risk to have a baby with Down syndrome and other chromosome conditions that are similar also goes up.
Okay.
But I also want to be clear to mention that anyone at any age can have a child with Down syndrome.
And I think that's a really important point, because we were just talking about that earlier, that sometimes there's that question, is it something that I did, or is there something that, was this my fault? So that's great that you're bringing some clarity to that, because that's something that I think is really important to reiterate.
I do too, because when you're told that your child has Down syndrome, you're getting used to a diagnosis. Everything is a little different. It's probably not what somebody was expecting. And then on top of it, to have this feeling that I did something wrong, it was my fault, it just makes it a lot harder for somebody to start adjusting to the diagnosis. So I really want to really emphasize the fact that when these things happen, they're just completely out of our control. And I want parents to hear me say that they didn't do anything wrong. And the next step is just like you said, just kind of getting educated about what causes it and then adjusting to the diagnosis.
Correct.
Yeah.
Right. So Katherine, let's dive a little deeper. So what is trisomy 21 and how does it occur?
Okay. Trisomy 21 is also known as Down syndrome, as I already mentioned. And it occurs most of the time when the mom's and dad's chromosomes are reducing from 46 to 23. So I mentioned that we're all born with 46 chromosomes. But when we have kids, we don't want to pass all 46 because they would have too many. So just the sperm and the egg cell undergo a specific reduction event right before fertilization. And when that happens, mom gives the child 23 chromosomes and dad gives the child 23 chromosomes. And then every now and again, just randomly, there might be an extra 21st chromosome that gets pulled along from one parent. So they give them 2 copies of chromosome 21 on one, and then the other parent gives them 1 and they have 3 copies. So that's most of the time what happens. There's another event that Ellie will get into some more detail about that is where the one copy of 21 first chromosome is on another copy of a chromosome, and that's called a translocation, which is a lot rarer, but it's something important, so she'll get into that in more detail.
This is such great information, especially for Down Syndrome Awareness Month that we're in, in October. So yeah, this is awesome. Thank you so much. So let's talk a little bit more about developmental health and just health in general. So how does having an extra chromosome affect those areas of your health?
Oh, that's a great question. So as I said earlier, that extra chromosome that people have with Down syndrome is typically in every cell of their body. Normally, there are some exceptions that Ellie will get into, but typically we have an extra copy in every cell of our body. And the consequences of having that extra chromosome mean that the genes that are on the chromosome are overexpressed. So there might be too much expression of certain genes. And researchers are still really diving into the chromosome 21 and figuring out what those genes do. But we've learned a few things. And so a few things that are pretty typical of individuals who have Down syndrome would be maybe when they're born, they might be a little bit lower on the muscle tone. So that might cause them to have difficulty feeding. So they might be underweight at birth, or maybe hard for them to breastfeed at the beginning. They have characteristic facial features, which I personally think are adorable and really sweet.
Adorable.
Yeah,
me too.
Of course, they're really sweet.
Yes.
And I think a lot of people who have kids or know people with Down syndrome are familiar with what those are. Some more serious physical features, though, can affect the heart. And what's interesting about that is that it affects the development of the heart. So it's a structural problem with the heart. And I think what's interesting, though, is that not every person that is born with that extra copy of the 21st chromosome will have a structural problem with the heart. So it's really important for everyone that's listening today to understand when I talk about what health consequences are resulting from that extra copy, it's not every person that will have these problems. So I think I want to make that really clear. And it just depends on what article you're reading, but maybe about 30% of people that have an extra copy of the 21st chromosome will have a heart defect. And that can be serious because that means that the child may need surgery right away or later in life. And so there may be more hospitalizations. Generally speaking, though, kids with Down syndrome also may have a little bit of a learning deficit. They may, and that varies widely, just like all of us. I want to really compare it to all of us, is that we're all on a variety of experiences in life, and we have a variety of traits. So Down syndrome is absolutely no different. But I will say one thing about Down syndrome is their personalities are absolutely loving and vivacious, and to a T, they're happy kids. Parents always talk about how giving and caring they are about others, and how much they teach their families about the meaning of life. So I think that can be really a true statement for almost everyone that I've met personally that has had Down syndrome. The good news is that as physicians and care providers are learning more about Down syndrome, they're being able to treat some of the things like the heart defects, and surgeries are available. So kids are getting operations earlier. And as a result, people are living longer with Down syndrome. Yeah. And so one thing that we're learning as we start to see an aging population of individuals with Down syndrome is that they are starting to have some conditions like diabetes at an earlier age, or dementia at an earlier age. And Ellie's going to get into a little bit of detail about the genes on that chromosome 21 that may relate to some of those problems. But I think one of the things that I want people to know, just to educate themselves on, is that adults with Down syndrome are more likely to have some of the conditions we see often when we're aging, but in our 70s or 80s without Down syndrome, they might have at a younger age, like 40s or 50s. Which is kind of a new finding and interesting, and I think it's creating a new need for physicians to be training physicians to see adults with Down syndrome, since they're living longer and they need care for some of these conditions.
Absolutely. So Katherine, everything that you've shared about the genetic makeup and the causes of Down syndrome has really, really been educational and insightful. Good. So thank you so much for sharing your insight and your expertise and your feedback as we celebrate, people, the beauty and the joy of people with Down syndrome, this Down Syndrome Awareness Month. So we're going to pick up with the second half of our conversation, and joining us is Ellie. She'll pick up with the second half of the conversation. We'll get into some more details. Sounds good. Thank you so much for being with us. Yes. Thank you. Hey friends, welcome back. So we're picking up with the second half of the conversation on sharing with friends. Joining us now is our friend Ellie McGregor, second-year genetic counseling student at ASU. She's going to get into more of the conversation of the genetic makeup and causes of Down syndrome. Ellie, we're so grateful to have you.
Thank you. I'm so glad to be here.
So let's start off with your questions. How many types of Down syndrome are there, genetically speaking?
Yeah, so when we're talking about Down syndrome, there is just one type physically, but when we look at the genetics, we do see some different types. So the two different types that we categorize them in is complete and then mosaic. So I'm going to talk about complete first. And complete means that, like Katherine was talking about, every cell of the body has that extra chromosome for the 21st chromosome. So there's 3 instead of 2 that typically people have.
Okay.
And so there are 2 ways that it can happen. And most people, it's like Katherine was talking about, we have just 3 separate chromosomes in people with Down syndrome. But sometimes there's something that can happen called a translocation. And this is about in 4% of people. And so instead of having 3 separate chromosomes, one of them goes on top. And this one travels together. Okay. And so that is when the reoccurrence of having another child with Down syndrome can be higher, because these are together. There's 2 copies of genetic information and they're stuck together. Okay. And so you have 1, 2, 3. But most people are 1, 2, 3.
Okay. Okay.
So again, most people are that trisomy 21 that looks like this, and then some people are with that translocation.
Okay. So the translocation that's a very rare occurrence then?
Yes, it's about in 4% of people with Down syndrome. So it's, it's significant, but that's the people that we see them having multiple children with Down syndrome, whereas more often, if it's the ones that they're all separate, it's going to be more sporadic or just random.
Okay, got it.
So it's good to look at how the chromosomes are made up to see, does someone have that translocation? Because that can tell us about the reoccurrence risk, or meaning what is the odds you'll have another child with Down syndrome. Okay. So that's, again, kind of making the makeup, like looking within the cells. And then then there's the complete and then mosaic. So with mosaic, that means that there are part of your cells that have the 3 copies of chromosome 21, and then some have 2 that we see in most people. Okay. And so when they call it mosaic, because it looks like a mosaic where it's those different tiles. And so some of the tiles have the 3 and some of them have 2. So this can affect symptoms, because if you have some that are 3 and some that are 2, you could have milder symptoms. Maybe not seeing as much of those facial features or learning disabilities, maybe not some of those heart issues. And so it just depends on the proportion of which of these cells have 2 copies and which of them have 3.
Okay. Yeah. So then, genetically speaking, so trisomy, mosaic, and translocation. You kind of got into this a little bit, but so let's talk a little bit more about the different outcomes or the different symptoms.
Yeah, so again, the way that it's inherited, whether it's translocation or it's the trisomy, that they're all separate, that does not differentiate the symptoms.
Okay.
So it's more the reoccurrence risk, like what is the chance that you would have another child with Down syndrome? It's more if you have complete or mosaic. So if all of your cells have that extra copy of chromosome 21, that's when we're going to see those more typical features across the board. But if it's mosaic, that's when we see, some milder features depending on what the proportion is.
Ellie, you and Katherine have done such an amazing job at just giving us an overview on the genetic makeup and causes of Down syndrome. So let's talk a little bit about prenatal testing when it comes to mom. So are there different ways to test diagnostically for Down syndrome, and how does that work?
Yeah, absolutely. I think taking a step back, most people find out that their fetus or their baby might have Down syndrome from a test called an NIPT, and that stands for non-invasive prenatal testing. And so this is something that's pretty typical in a workup, and it takes mom's blood and looks for baby's chromosomes in mom's blood. And so the test can show that there's 3 copies of the chromosome 21, as well as the sex or gender of the baby. And sometimes people think, oh, this is just a gender test. They want it for their gender reveal party. It's very exciting, but this is also what this test is looking for. So when this NIPT is performed, it is not a diagnostic test. It's just to survey and see if this is a possibility. So after the results of the NIPT come back, you'd still need to perform a diagnostic test. The NIPT is only a screening. And so there's 2 different types of diagnostic tests. There's an amniocentesis and there's a chorionic villi sampling. And so that's something that you would discuss with your prenatal, physician, and they could help move forward after that NIPT test is performed.
Okay. Ellie, such great information. So let me ask you this. Are there any specific genes on chromosome 21 that are linked to common features of Down syndrome? Can you get a little bit more into that for us?
Yeah, that's a great question. Because as we're looking at our chromosomes, they're kind of split up into different parts called genes. And each of these genes have a job to perform. And so like Katherine was talking about, sometimes we see heart defects or issues, and some of our genes' jobs are to build heart muscle. And so there are some genes related to heart muscle and function on chromosome 21. And so when we have 3 copies of those, that's too many, and that can affect how the heart is formed. There is a specific gene called APP, and we have seen a lot of correlation between this gene and features in Down syndrome. And actually, specifically when they were researching this gene, they found that it was related to dementia. And as Katherine mentioned, we see people with Down syndrome getting dementia earlier than we would expect in the general population. And so this studying people with Down syndrome and discovering this APP gene helped to do research for Alzheimer's, because we see that actually mutations or changes within this gene can affect people and maybe increase the chance that they'll get Alzheimer's in their life. So I think it's just really cool that research around people with Down syndrome, it's helping to increase the health of people everywhere with a lot of different disorders.
And just the longevity too. Research has just come so far, and it's just amazing to watch it all unfold.
Absolutely. Yeah. So we're still learning a lot. Genetics are so complicated, even for us who know and learn about it. It just baffles us every day. But as you said, the research is improving, so we hope that continuously as research discover more, we can help improve the health and quality of life of people with Down syndrome.
This conversation has been so good. We hope that you have found this conversation just to be so helpful, so insightful. Both you and Katherine have just been such great guests as we explore and talk about more of the genetic makeup and causes of Down syndrome here on Sharing with Friends. On behalf of Sharing Down Syndrome Arizona, friends, you'll have to make sure to pull up a chair next month for our next episode and our next guest, and happy National Down Syndrome Awareness Month.
Yay!